Dr. Vaishnavi Yeleswarapu is a dental professional who graduated with a bachelor's in dental surgery from the Rajiv Gandhi University of Health Sciences. She briefly worked in private practice before pursuing a master's degree in dental public health at the Queen Mary University of London. It was then that her inspiration was triggered and she began ideating dental comics. With support from her colleagues at NHS England, she interned there and she decided to seriously pursue the idea. She began learning digital art and related software to publish them on her social media page, Tooth Comics. Dr. Vaishnavi worked in the edtech industry as well as with a children's author, and she believes that these unique experiences helped her create better structure and storylines in her comics. She began her entrepreneurship at starting the Trooth Place, where she provides stickers and activity sheets for positive reinforcement of pediatric patients. Dr. Vaishnavi upskills herself by writing short stories regularly and is about to embark on a PhD journey that combines all her acquired skills researching the effectiveness of graphics in oral healthcare. Thank you, Vaishnavi, for joining this session and thank you for accepting my invitation. I once again welcome you to Eclectica. And today, to my audience, I have very interesting person with me, as you can see already inside the studio. And you will see that how career turns takes in life and where and what we think actually changes, but we land up in a something in a dream place. So I welcome you once again, Vaishnavi, and I think we will have a fantastic chat today with you.
Thank you so much, Dr. Gargi. I'm so happy you invited me. I'm so glad to be part of this show with you.
So I think I have a lot of questions to ask today, and I think it will be kind of a fire chat. I think so. So before going into anything, as I know that you have been trained as a public, public health dentistry, if I'm not wrong. So just tell us about you and your journey. How
Yeah, so I've always been curious about the human body ever since I was young. The health sciences, human body. I I once saw my mother borrow a library book about human anatomy, so I think that's where it started. But fortunately, as I grew older, I began to like the subject even more and prepared for my exams like everybody else, and finally got a seat in dentistry. And surprisingly, as I was studying, I found it more and more interesting. I mean, such a small part of the body, and there is so much to learn about it. So yeah, and I realized that was the right career choice for me. As for public health, dental public health, believe it or not, I disliked it so much during my undergrad. I actually scored 9 out of 100 in my first test in my undergrad. But then, I later tried to understand it more. I tried to understand the concepts, why we're doing it, what is the benefit of public health and all those things. And I found it very inspiring. uh, I don't know how that happened, but I really found it very inspiring. Unlike, in clinical dentistry where we just treat a person, it's basically tertiary prevention.
Correct.
The disease has already set and you're just treating the disease. So what I like most about public health is that you're not waiting for the disease to start. You're trying to, block it right there, prevent the disease from even occurring. And so that is something I really like about public health. And your interventions can actually impact the public, the entire public, not just one individual who comes to sit with you in the dental chair, but the entire society as a whole. So yeah, that's the reason I started enjoying public health, and because I think because of my education as well, there were a lot of inspirational people that I met, who I think pushed me to like it even more.
Great. No, I completely agree with you because see, whatever when it comes to healthcare, I think we we have a moral. I feel personally it's a social duty rather than moral or whatever your professional, whatever you want to achieve, that is there. But I think this field of dentistry actually equips us with that power where we can handle people at mass, and you really go and connect to at the ground, I mean at the ground root level basically. So I think that's a
Yeah,
very
that's the
interesting
oath
field.
that we've
Yeah,
all taken, do no harm. So
exactly.
we're doing no harm at all. Before the
Ex-
harm even occurs, we're trying to stop it there.
Yeah, yeah. So that's nice to know your story. So, well, I think a very interesting part or your passion or talent, whatever I came across, is about your getting into digital art and your artist side. So my next question would be directed to that. So how do you incorporate this talent of yours, like particularly the digital art and storytelling, into your work as a dentist and obviously as a dental public health specialist?
Yeah. So before I come to how I incorporate it, I'd like to share why I need to incorporate it.
Right.
So the reason behind it is that we often tend to forget that there are diverse learners in the society. What I mean by that is there are people who learn from visuals, there are people who learn from audio, people who learn from hands on experience. And all these people again have a different pace of learning. Some can comprehend things quite very quickly and grasp the concept, while others take their own time. So, what I've noticed is that traditional methods of healthcare information are very verbal, or they're through text, and not everybody can learn that way. Not everybody can understand a given concept in that way. So, and these are actually persistent in our classrooms as well. In our classrooms, in the clinical settings, it's always verbal and textual. So, comics and animations, on the other hand, provide a range of inputs, like visuals, they have text, there are relatable stories, and sometimes even audio that helps people grasp the concept a little better and at their own pace. So they can still pause it, and if they don't understand something, replay that to try to understand it. So I discovered that I learn best with visuals, and I tend to relate some concept to a story to something that I have previously experienced. Uh, Also, I love anime, manga, and I read fiction novels a lot. So I have that sort of thing also going on inside my head. So, yeah, apart from just imagination and creativity, what I try to do is learn about people from different backgrounds, understand their perspectives, and attempt, it may not be perfect, but I attempt to, create a storyline and the graphics so that it's tailored to them as well, so that they can also relate to what I'm trying to tell them. Yeah.
So really interesting, and I just a quick question is just running through my mind when you were speaking. Like, were you trained like a cartoonist or an artist, or it was just like how we every child learns? In Indian family, you should learn painting, painting, singing, dancing. Everything would be imposed. So how is this? How can you tell us this part as well? I mean, I'm very interested to know.
No, I was never trained. It's just that interest in
Wow.
anime and cartoons.
Excellent, excellent. And I agree with you. Like, it's not only about you that who likes to learn in visual, but I think the human brain, it actually captures only visuals. So,
Correct.
so that is the reason why we remember movies, even if we have seen it 10 years back. But ask any page or a topic, we really have
We
to.
will not remember.
We feel so embarrassed. We need to go back with inside our fat books and look into it. So that's really fascinating. So, I know that you are going to pursue your PhD very soon in a foreign university. So, but your discipline is again very unique. So I'm very fascinated to know that how your how you actually modified your career pathway, taking your talent as well as your passion, and you are giving a direction to it. It is very interesting. So I think for our audience also, it will be a very interesting fact that should come up, I think. So my next question is that what motivated to you to do PhD in the effectiveness of graphic, rather particularly comics, right? Educational resources for oral health in adolescence, and how did you become interested in the multidisciplinary topic? Because this is something which is very unusual, and you become being a dental specialist already. It is something which is off track than the conventional. So please tell us more and more on this.
So it was a gradual process. The idea, of course, did not come to mind all of a sudden. So during my undergrad, when I listened to those long lectures, sometimes I would try to make them into a film in my head, a pictorial film in my head, and I would whatever I heard, I would draw on my notebook. Also, when I was studying masters in the UK, there was a one of my professors actually showed me a storybook, a children's storybook, where they were trying to teach children the correct way to brush and all that. So they conducted a research on that. It's called the BBAT study by Professor Cynthia Pine and her colleagues. So yeah, that again was another inspiration to me, because I knew, okay, then I knew this can be something that I can do myself. When I so later on I interned at the NHS, and I had some really good support from my colleagues over there. So I drew some diabetes related short comics, and they were really happy about it. So I thought, okay, why not try it in dentistry as well? So I started drawing in dentistry, sorry, in oral health, and put them up on social media. But then I began to realize how effective they might be to the public. So I mean, there was no point in just doing it. There needs to be a result for it. So I did a brief literature search online, and to my surprise, I found an ocean of research articles on graphics and how they've been used in healthcare previously. So there are organizations across the world, including in India, who work in this field.
Wow.
One of them is graphic medicine, which is I'm actually trying to start that in India as well. So,
Fantastic. Fantastic.
and we also have, okay, I'll come to that later. But yeah, there are some organizations and individuals across the world who work on graphics in healthcare. So I dug deeper, and I realized, they were done in areas like diabetes, cardiovascular diseases, mental health, immunization, also in education, like medical sorry, medical students, nursing students, and all that. And recently, even COVID-19 comics had come up to educate people. But the thing is, I realized that none of these were related to dentistry. So I thought, why not pursue it by myself? Start something by myself. So in this way, one, I can find the effectiveness of my work, as well as try to improve myself, and how I can better my approach so that it reaches people the way that I intend to. So yeah, I read more about graphic medicine, and there's more to graphic medicine than just images and stories. It, like you said, it's multidisciplinary, and one person, of course, cannot do everything. But I still did attempt to learn arts, and there's some cultural background learnings involved. There's pediatrics, because I will be working with the adolescents. I'll need to understand a bit of pediatrics as well. So there's that, and humanities, health humanities, ethics, uh, the right educational strategies to use for it to be effective, and of course, dental uh, education, dental information, and medical information as well. So there's a lot of things that are involved, and fortunately I have found a really good team of supervisors who are again multi-talented. So uh, yeah, it's a great way to challenge myself uh, as well, and I am also interested in most of these topics myself. So yeah, I'm always up for learning something new.
Great. And I think your PhD will actually equip you with all the necessary more knowledge, or maybe the domain knowledge. You tend to become because a kind of expert, because I think a PhD is kind like it converges you to a specialty more. I mean, you go more into the core. So I think that will definitely bloom you up in this domain. So it's
Totally
really
agree.
interesting to know what you are all telling. But and I think it's a very good thing that you thought that you should do something for your country. You try to bring in this the kind of community you have known and you have benefited, and today you are thinking it to make it as your career. Thinking not, I mean, already you have stepped in. So I think this kind of things is it's not about being new, but I think it's more about innovative ways. And we need to really break the myth in dentistry that runs, at least in India, is it is saturated, we don't have opportunities. I think people like you would really really inspire everyone. So well then, so can you tell me some of the strategies or methods you use to communicate complex medical information to patients in a way that is accessible and engaging? Because I think you are into more into storytelling part. So I think if you can just share some strategies and your thought processes, how exactly you execute things.
Yeah, so the first thing I do is try to ask myself whether my younger self would understand what I'm trying to convey. And when I mean my younger self, it's before I even studied dentistry.
Right.
So I try to avoid as much jargon as possible so that any layperson can understand what I'm trying to convey. Also, try to make it a bit humorous and relatable. Uh, everybody likes humor. So yeah, and I think that's a really good way to learn. I worked in the education sector for a while as well, so that actually got me to thinking about the structure of how I produce something. So first, introduce what it is. Not everybody, like when I say root canal treatment, not everybody might know root canal treatment. So the first thing is tell them what it is, tell them what it means, break it down into smaller pieces so that they have an understanding of what that means. And then gradually build up on that so that their knowledge also increases in a gradual way. So, yeah, it was a benefit that I worked in the education sector and tried to understand that. Another thing is I write short stories. So, I took a
Wow.
workshop from one of the children's authors, Indian children's authors. So that was again very helpful. Think of a character, design the character in your head, and try to give some characteristics to this character that you've designed, how they are, what they like, where they are from, and things like that. So those tips actually help me get a better understanding of how to write a story and how to think about a story. So yeah, that's that's how I.
Fantastic. I think you are multi-talented, which I see you are a storyteller, and you have worked in different facets in this very very young age. You have tasted many platters, which is a very good thing. And I think
Not an expert, but I'm still trying.
that's the best thing. I mean, that's the best thing. So, and when we start thinking we are expert in a domain, I personally believe that that is the end, because we cannot become expert in a certain thing. It's all about continuous learning. Maybe we focus in one area in a particular
Exactly.
time more than the other. So,
Completely agree.
yeah, so that's really interesting to know, and how your thought process, how how you articulate all these complex stuff I think it's a great job, and I think it's not an easy job as well, because I am personally a science communication enthusiast. So it is easy to talk your domain to your domain colleague or personal, but it is completely very hard to make complex things simple and not losing the essence as well. Because
That's
uh,
true. I see a lot of dentists. Just recently, I saw a dentist saying your rates are impacted. And coming from a dentist, yes, I understand what that means. But
yes,
imagine the patient, where the patient's face is suddenly changed, like, eight? What do you mean by eight? So,
you don't even know what is eight, and you know yeah, that's correct, that's correct. So just a general information about your insights. I would like to know, like, what role do you see as kind of art and storytelling playing a role inside healthcare education? So what is your opinion? How do you see, because you are the present generation and you are trying to take things forward, so I
Mhm.
think your insight will be very, very important.
Yeah, so technology uh, has been growing over the last 5 6 years, even more than what it was in the early 2000s.
Exactly.
So technology definitely has a lot to offer in the industry, especially in a country like ours, where uh, dental professionals are continuing to use traditional methods, whereas there are so many uh, technical advancements out there that can improve their practice. And it's just unfortunate that our curriculum also does not provide us opportunities to explore all this. But yeah, slowly I've noticed that it has been changing in the metro cities. We have people coming up with digital solutions to a lot of clinical problems. So, of course, if you look at the advancements in clinical dentistry, there are a lot, too many options for doctors to, stumble upon. But with respect to dental public health, I don't think there are much out there. Um, Mainly because most public health programs focus on, just awareness talks,
Yeah.
engagement, and maybe tertiary prevention to some extent, like pit and fissure sealants and things like that. So again, that is invasive. We are not trying to be non-invasive and do something even before you can, touch the patient and
Right.
perform any procedure on them. So, like oral health related policies, primary preventive strategies, especially in India, they're very limited, I feel. So, and even if we did have this, the one of the key issues is the mentality, the behaviors and the perceptions of the public as well towards oral health, because it's quite very often neglected, and I think that's quite a challenge to tackle. So we can do it. We can, because we do have the most number of engineers in our country, the most number of smartphone users in our country.
Right.
So there is a huge opportunity for us to build something digital for public health right there, because we have the resources. We are rich in resources. So I think it's crucial that we have a multidisciplinary approach, which is evidence based, and we can create digital interventions to target these health behaviors of
Right.
our population. So obviously the applications have to be age appropriate, because we are a large population.
Yeah.
They have to be culturally appropriate language as well. They need to be motivating enough for someone to pursue it on the long term.
Correct.
So off the top of my head, if I think about it, maybe we could have a digital system like the Nike training app. I don't know if you've heard of that, but they have quick video instructions.
Yes.
So like 15-minute video instructions, they're very quick, and it's so easy to follow them as well. So something like that, or short stories and series that end in cliffhangers, so that like there's an app called Webtoon, which
Okay.
has daily series of anime, sorry, manga. So something like that, where people want to keep on reading and want to learn what comes next.
Correct.
And then the healthy habits games, like helping people practice daily challenges or goals. So Duolingo is an app like that, which
Yeah.
you keep on going higher and higher. It wants, you're so eager to level up in that and achieve the daily goals.
Exactly.
So that pushes, that gives that motivation as well to a person. And then interactive simulations of dental procedures. So most often patients don't know what's happening, what the procedure is all about. So FET is an online resource that actually shows simulations of scientific procedures. So if we have something like that for dental procedures, and patients can, or whoever is using the application can do it by themselves. Okay, now I have to take the aerator and put it over there and clear off all of that. So things like that, quizzes as well. Quizzes are very motivational. So there is so much that we can do, and we have all of the resources. So yeah, and the outcomes that we can get out of these health outcomes, especially improved health literacy, people will start learning what oral health is all about. There's more self efficacy. They'll know, okay, this is how I need to brush my teeth, this is how I need to floss. And oral hygiene practices, they can start improving. Improve disease burden, anxiety, so reduces that fear of going to the dentist.
Actually.
Attitudes, they'll be more motivated as well. So yeah, I really think there's a huge potential in using technology for public health.
Fantastic. So, Vaishnavi, how did you came to know about the program, PhD program that you are going to pursue? Or basically, I would like to ask it in a different way, like how did you crack a PhD position, that too in a foreign university, in the domain of digital storytelling? And this is something which is extremely interesting. Yeah.
Uh, so I did search for a lot of countries initially, but this particular university I'd heard multiple times. So I got an offer, PhD offer from the University of Otago in New Zealand. I had heard good things about the university previously. I was supposed to do my master's there, but not for some reason. So yeah, so that was my first choice to look at.
Okay.
And fortunately, when I was searching for supervisors and mentors, there was one person whose interests aligned to what I was looking for. And when I reached out to her and proposed my research idea, she was really interested, and she got in. She got me in touch with a couple of others who were also interested. So I think it's just a that matter of willingness to do something new, and also show to them that you are willing to continue your learning and try out, and you're not afraid to take risks and try out new things. So uh, yeah, and also the thing about research is that PhD programs, especially, I've heard a lot of people have this misconception that the more articles you have published in your name, the better it is for you to get accepted. But well, to some extent, I think that is true. But it's more about the impact of what you're doing and the quality of what you're publishing. It's not just
Numbers.
I've got this published in my name. That is not enough. So we always, research is all about trying to look at something in a different perspective, and being proactive about it. So I guess that's how I was able to do it.
Very nice, very inspiring. So, Vaishnavi, I think, is there any way you try to, this excellent talent, is there any way you have tried or ventured into monetizing it somewhere apart from your academic, or rather, if people want to, get in touch with you, do you have any website, web portal, or as you mentioned, your Facebook page? So just give us that information, or maybe Instagram. I don't know, like how where people can find you if somebody is getting motivated through this conversation and they want to get. And also, I'd like to know, like, if you have any done anything to monetize your talent. Yeah.
Yeah, so last year I started this small business called the Truth Place,
Wow.
which is basically all my work put together. So what I do is, uh, so one thing I was really passionate about apart from comics was, start young and reduce that fear of going to the dentist.
Hmm.
Uh, I've noticed that a lot of parents try to scare their children,
Yeah.
saying, if you do something wrong, I'm going to take you to the dentist.
True.
And
Very
it may be just a small thing, but I personally felt offended because I'm a nice person. So, yeah, so I started creating these stickers to
okay.
positively reinforce children. I actually use them in one of the dental camps that I've been to. It's just animal stickers of animals and just a short phrase of encouragement. So
Okay.
I have five different type designs at the moment, but I do plan on making more. And they were really, I mean, people really liked it, and I do sell them on the internet as well. So I sell them on Meesho.
Okay.
I can share the links to that as well.
Sure.
So I do that, and I've also created activity sheets for children, like 30-day activity sheets for them. So eating five fruits and vegetables a day, eating
Mhm.
healthy. So for 30
Wow.
days, they have to eat five fruits and vegetables, or brushing twice a day. So they color the sun if they brush in the morning, they color the moon if they brush in the evening. So I've created activity sheets like that as well. So these are all offline, and online. Recently, I've started creating comics of research papers.
This is very
So,
interesting. All right.
yeah, so a friend of mine published a breakthrough research paper recently, a scientific breakthrough
Mm-hmm.
paper, and being a dentist, it was difficult for me to understand it because it was in the dental field. So I thought of cutting it down to a layman's perspective, and I created this short comic on what they did during that research, and that became quite popular, including at the Indian Orthodontic Society as well, and SRM Dental College in Chennai. So that that's something that I plan to continue because most often what happens is research articles don't they, the readability level of research articles is very high, and it, it loses that in a layman who is supposed to understand
Correct.
what research is and appreciate the effort that they've put in may not understand. Ideally, it should be like a 12 or 13-year-old should be able to understand your findings, and
Correct.
or people who can convert or translate that to practice everyday
Mm.
life. They don't. So which is I mean, not surprising because being a dentist, I couldn't understand it myself. So that is again something that I am working with dental professionals to bring their research into a comic format.
You
So
offer
yeah, lots
services
of
in this area. Yeah, you basically offer your services in this area.
yes,
Great.
yes.
Great.
So I have a Linktree page with links of all of these in the same page. I also have I'm very active on Instagram. It's called Truth Comics. All my comics are on Instagram
Okay.
as well. So yeah, they can find me on Linktree and Instagram.
Great. I think that's wonderful. And just that we need to conclude, but it is a very interesting conversation that is going on. So my usual question to any of my guests is that, because you are following your passion, you are doing something in your domain, and you look up to take this forward, and you know bring, at least try to bring a real change in some way. So what would be your advice? What would you advise to young aspirants, particularly the public health specialists, dental public health specialists, or researcher who are interested in pursuing a multidisciplinary work like you, or if they are searching some innovative domains to work just like you did?
Well, I would always say take the risk and go for it. It's always two experts are better than one. Kind of like how you mix primary colors. We just have three primary colors, but when you mix them in different ways, you get a whole range of new colors, which may not be possible if we were just looking at red, blue, and green. So I feel like multidisciplinary work has so much potential, and we might just come up with some phenomenal inventions if we do work with experts in other fields. So, and additionally, we can grow personally as well. So we'll start learning about these new areas and gain new perspectives. So yeah, go for whatever and risk it. The risk is worth it.
Fantastic. So I think all of you who have been listening to us on this conversation, and you see that, anything, like if you want to follow your passion, yes, every field has a challenge, but you see a real person sitting here and how she has modified her talent, and how in her inquisitiveness and curiosity made her land up into a, one of the highest degrees in academics, and she's going to pursue it, and also how she visions to bring this thing back to the country. So I think this is very inspiring, Vaishnavi, and it was wonderful talking to you, and I hope that we'll cross paths in the future very soon, and we will have more such chats in the near future. So I congratulate you on your new PhD role that you will be playing very soon, and I wish you all the best in all the endeavors, all your visions that you're thinking of. You're doing a great job.
Thank you so much. It was a pleasure talking to you as well.
Thank you. So stay tuned on Eclectica every Friday at 8 p.m. IST, and don't forget to subscribe my channel. Thank you so much for tuning in with us and staying till the end. And please leave your comments, and if you want to reach Vaishnavi, you will get all the links in the description of this video. So don't hesitate, and you can also plunge into digital storytelling as one of your career paths. Thank you.